Hi, we are group 2 for coordination of care, and we are doing a Teachback education, and we are doing it on levothyroxine and hypothyroidism.
Okay, hi, is it now a good time for me to come in and do some discharge education?
Yes.
Perfect. I'm Olivia, we've met earlier, but I'm going to be your nurse today doing the discharge education.
My name's Abby, I'll be your tech for today, so I'm just going to do your discharge vitals.
So right here, this is your discharge packet. This is all the information we're going to be going over today. She's going to take your vital signs, and I'm just going to let you know what is in this packet.
Okay.
So we have some wordy information. I'm going to help make it a little bit easier to understand. And there's also some flyers in here for when you go home. They're nice and colorful and really easy to understand, just in case you have a question and you're not able to call anyone to get that answer right away.
Okay.
So we'll be covering things such as the new treatment for your hypothyroidism, as well as going forward with a few reminders that are going to help you remember how to take it and manage it. Can you tell me what you currently know about your hypothyroidism?
I know that I have to take this medication for the rest of my life, at least that's what the doctor said. But I don't really know anything else other than that.
We'll be able to go over any questions about the medications, because I know this is new for both of us, so we're just trying to get used to it.
Of course. If you have any questions at any point during the education, just feel free to stop me. Just to start, your doctor has prescribed you starting on 25 micrograms of Synthroid. This is the medication that's going to manage your hypothyroidism and any of those associated symptoms.
Okay. I do remember him saying something about that. Am I supposed to take it with food? Because sometimes when I take the medication, like I get an upset stomach and I don't want to feel bad when I'm taking the medication.
Right, yeah. So it is best to take Synthroid on an empty stomach. We usually suggest about an hour before breakfast, and if you can do a little bit more, that's even better. It might cause some insomnia at nighttime, and then it also, we suggest that you take it first thing in the morning. Some other side effects I have are listed right here. You might feel some stomach upset, nausea, or vomiting.
Okay, and then sometimes with my other medications, I take like my vitamins and supplements. Am I still able to like take those with the medication, or like is that gonna like affect anything? Or
right now, what's happening is your thyroid isn't working exactly the way we want it to.
Okay.
So it's not creating enough of a hormone called thyroid stimulating hormone. With that low amount that your body's producing, that's why you have some of those associated symptoms like your stomach aches, maybe fatigue, nausea, vomiting, any cold intolerance, unexpected weight gain. So this medication is going to help you manage that and increase the thyroid stimulating hormone.
Okay, that makes more sense.
Yeah, of course. I also heard you mention vitamins earlier. So with this medicine, it's best to avoid taking over-the-counter vitamins, especially ones containing calcium, just because that can cause the medication to not be as effective. Just to tie up a few other loose ends, make sure that you report any palpitations or fluttering in that chest, or any abnormal heart rate to your provider. We just don't want any reactions to progress any further from hypothyroidism or the medication. So once you start taking it, it might take a few weeks to see any improvements, and family, you'll definitely be able to notice this improvement. But if you're concerned, the provider will definitely be able to answer any questions that arise. Do you have any further questions?
I don't. So it's just in the mornings before I eat, an hour before I eat, and to avoid supplements with calcium.
We're gonna do some Teachback. It's my way of ensuring that I'm not sending you guys home without any misinformation. So before we go, could you tell me how much Synthroid you're gonna be taking once you're at home?
Yes, 25 micrograms.
Awesome. And then what is the best time of day to take the medication?
In the morning, about an hour before I eat on an empty stomach, and I should avoid calcium and other vitamins because it can cause a reaction.
Good. I'm glad that's confusing for people to understand sometimes. So last question, when would you contact your provider regarding some side effects that might be a little bit concerning?
If I feel any palpitations or if my blood pressure is off.
Perfect. Well, it looks like that's all I have for you today. I'll definitely leave all this information with you as well. And this has the remainder of your other discharge information.
Okay, thank you so much.
Thank you. Of course, do you have any questions? Awesome.
Okay.
Perfect. Thank you so much.
Thank you.
I'm going to go document that the patient understood the information.